The Medical Patient Assessment and Management Station is designed to test a candidate's ability to systematically examine a patient with a medical complaint and to appropriately manage the conditions found. With the exception of the actual hands-on assessment portion of this station, the rest of the station involves verbalizing the treatment for the patient. Candidates can assume that there are 2 additional providers able to carry out any treatment procedures verbalized by the candidate. Candidates have 15 minutes to complete the station.
You will want to conduct your medical assessment as you would in the field in a systematic manner. Communicate as you conduct the assessment. State what you are assessing and what care you are providing as you perform each step so that the examiner can see and hear what you are doing. Remember to use the mnemonic sample to collect information about a patient's medical history.
Candidates at this station will have equipment and supplies necessary to assess and manage a patient with simulated medical emergency. The medical patient will be moulaged as necessary to help depict the desired condition, such as diaphoresis or pale skin. Equipment and supplies for assessing the medical patient can include a stethoscope, BP cuff, cardiac monitor, glucose meter, and pulse oximeter. Medical exam gloves are available as part of the necessary personal protective equipment. Equipment and supplies for treating the patient's condition may include items such as supplemental oxygen, BVM, IV fluid, and medications. These items are present simply as props, and you are not required to actually use any of them. Only verbalize the use of them should the patient's condition require this intervention. The main sections of the Medical Patient Assessment and Management Station involve BSI precautions and scene size-up, initial assessment and resuscitation, focused history and physical exam, ongoing assessment, and managing the patient's medical condition appropriately.
Welcome to the Medical Patient Assessment Station. You've had an opportunity to check your equipment. Do you have any questions for me at this time?
No, ma'am.
Okay, we'll begin our scenario. You are dispatched to a local residence for a 35-year-old male with difficulty breathing.
Okay. I'm going to take proper body substance isolation. Is the scene safe?
Yes, it is.
Okay, it appears that I have one patient. Nature of illness would be trouble breathing. Do I have any bystanders to give me any more information at this time?
Not right now.
Okay, right now I'm going to hold off on calling additional resources until I get some further information. It appears that there's no trauma to the patient, so I'm also going to hold off on taking spinal immobilization. I'm now going to approach my patient to get my general impression. Sir, how you doing? My name's Nicole and I'm from the rescue squad. What's your name?
Matthew.
Matthew, what seems to be the problem today?
I can't breathe.
You can't breathe? Okay. My patient is conscious and has an airway in his breathing, but it seems to be difficult. I'm going to go ahead and place oxygen, 15 liters via non-rebreather on my patient. This should make you feel a little better.
Okay, I understand you're putting him on oxygen. You can turn it off from this point on and simulate it.
All right. Okay. All right. Sir, I'm going to go ahead and take a pulse real quick. Okay, his pulse is strong and regular. His skin seems to be pale, cool, and moist.
Okay, for the purposes of this scenario, his pulse, his radial pulse is weak and fast, and his skin is pale, cool, and moist.
Okay, I don't notice any bleeding, but I do see that there are hives on his skin. At this time, I'm going to say that he is a high priority patient and he needs rapid transport. I'm going to go ahead and begin interventions and transport him to a medical facility. Okay, so with your trouble breathing, exactly what were you doing when you started having your trouble breathing?
I was leaving the restaurant.
Okay, and is your trouble breathing getting any worse right now?
No.
No, is the oxygen helping at all?
No.
No, okay, what exactly does it feel like?
It feels like really tight in my chest. Like there's a weight on my chest.
Okay, and other than right here on your arms and on your neck, is it itchy anywhere else, or is it just right here where I can see?
It's also on my chest.
On your chest also? Okay. Now on a scale of 1 to 10, 1 being the least and 10 being the most, how exactly would you rate your trouble breathing?
It's about a 7.
About a 7? Okay. And about how long has this been going on now?
About 20 minutes.
About 20 minutes. Okay. So other than your hives and your trouble breathing, is there anything else that you're complaining of today?
I'm really itchy.
You're really itchy too? Do you have any allergies?
Yes.
You do? What are you allergic to?
To peanuts.
To peanuts. Are you taking any medications?
No.
No. What kind of medical history do you have? Have you ever been hospitalized for any peanut allergies?
Yes.
You have? Okay. What was the last thing that you ate today?
Lunch.
Okay, you ate lunch. Did you by chance eat any peanuts at lunch?
Not that I know of.
Not that you know of. Okay, and other than eating, were you doing anything else?
No.
No, not at all. Okay, sir, is it all right if I lift up your shirt and take a look at your chest and your stomach?
Yeah.
I'm also going to listen to your lung sounds, okay?
Okay.
All right. Okay. The lung sounds are clear in all lobes?
For the purposes of this scenario, he has wheezes in all lobes.
I'm going to have my partner obtain a baseline set of vitals. What are my vitals?
Respirations are 24, shallow with wheezes. Pulse is 112 and regular. Skin is pale, cool, moist with hives. Pupils are equal and reactive, and blood pressure is 88/60.